Good morning, everyone. My name is Anna Dexter. I'm here from the AMA social media team with my colleague Caitlin Gannett. Welcome from AMA headquarters. Today we're joined by Andrea Garcia, the AMA's Director of Science, Medicine, and Public Health, to talk about the timely topic of the novel coronavirus. Andrea, thank you so much for joining us today.
Thank you so much for having me.
Awesome. So let's get right to it. Can you share a little bit about your role here at the AMA, its relationship with the CDC? I imagine that in the wake of this recent outbreak, you've been in close contact. Is that fair to say?
Yeah, it is. So just a little bit about the Science, Medicine, and Public Health team to start. We're really focused on providing sound scientific information to inform the AMA's initiatives and its policies. My team works really closely on the issues of public health, precision medicine, and drug policy. And we're really proud that our work is really central to the AMA's mission of promoting the art and science of medicine and the betterment of public health. In terms of our relationship with the CDC, I think we have a long-standing relationship with the agency. There are many centers that make up the agency, and we have good relationships with almost all of them. My team is certainly not the only one within the AMA that works with the CDC, but from my perspective, I do think that we try to share information. If our Council on Science and Public Health is developing a report, if we have new policies or new directives coming through the House of Delegates or new tools that have been developed for physicians on public health issues, we certainly share them with our colleagues at CDC. And as both of you know from the social media team, the CDC often comes to us and asks for help in amplifying messages for physicians and for patients to make sure that they're aware of the important information that's coming out. But I also want to mention the groups that we work with on the national level that are really integral to this outbreak and this investigation, and those are our partners at the state and local level. So the Association of State and Territorial Health Officials, the National Association of City and County Health Officials, and then the state and territorial epidemiologists.
That's so awesome, just to know that these relationships exist. You guys are in close contact often, I would imagine, and I think that really comes across in the information not only we as the AMA distribute on our channels, but working in close coordination with them, knowing that our voice is a part of that. That's really awesome.
Yeah, well, the medicine and public health voice together, I think, is very important to addressing outbreaks such as this, but public health in general.
Yeah, so it certainly sounds like you've had a busy week. What have you learned that you can relay for us right now?
So let's talk about what we know so far. So this started about a month ago in Wuhan, China. There are now over 800 cases there, and we know that there's human-to-human transmission that is happening. There have been 26 deaths. In most of those deaths, the person had an underlying health condition that made them more susceptible. We also heard this week from CDC that there are 2 cases confirmed here in the United States, one in Washington State and one in Illinois. And we heard from the CDC this morning that there are 63 cases under investigation, and 11 of those have tested negative. So some of those are still in the process. But the CDC has certainly been integral in providing advice to physicians on this, so physicians know what to do. If a patient comes in and has symptoms, which include a fever, cough, or shortness of breath, they should absolutely be taking a travel history. That's going to be a really important factor in determining whether this is a patient under investigation. And then once you have that information, it's very important to contact your state and local health department so that they can get involved.
A question I have for you, you mentioned a travel history. Is there a certain time frame, a matter of days or weeks, that are really critical to assigning whether or not this person may have come into contact with this virus?
So based on what we know so far, the CDC is saying 14 days.
14 days.
Yeah, you brought up quite a number of health agencies, and it sounds like there's a robust network. So you got into it a little bit, but what are those public health agencies doing to contain this and also get information out there?
Certainly. So obviously, when we think about health, most of us think about the healthcare system. We think about hospitals and doctors. But there's also this system of the public health system, which often works behind the scenes and people aren't as familiar with. But they're working every day to keep us safe and to protect our health. We see this often during infectious disease outbreaks, and that's when we become more familiar with the work they do on a day-to-day basis. I think right now we're seeing a really coordinated response across the governmental public health system, so federal, state, and local. We know that CDC has set up its Emergency Operations Center. We know that they are working in ports of entry across the United States, so in our airports, screening passengers coming in from Wuhan, China. Though we also know this week China has limited that travel in and out of Wuhan. We also know that the CDC is the lab, it runs the lab, so they're doing the testing on the samples, and they're working to get the tests out to state labs so that they can run those tests in a quicker manner, so not having to ship those samples down to CDC. I would also say on the state and local level, like in those jurisdictions where we have confirmed cases, the state and local health department are tracing the close contacts of those who were infected to try and limit the spread of the virus.
So you spoke about what these public health agencies are doing to address this novel coronavirus, but what can physicians and even the public do to stay up to date on the latest developments as it pertains to this novel coronavirus?
Yeah, that's a great question. So we know this outbreak is ongoing. It's still early. We don't have all of the information we need at this point, and we're learning new information every single day. And the information and the guidelines and the recommendations may change as we get more information. So it's important to pay attention to what the CDC and what your state and local health agencies are saying and the advice they're giving, both to the public but also to physicians and healthcare providers, because all of us working together is really integral.
You know, you mentioned what's being said and what to pay attention to what's being said, but speaking of that, there's been quite a lot of conversation on social media about this. We've been observing a number of mentions of hashtag coronavirus, which we've actually outlined over there on the whiteboard. This is since Monday, so January 20th. Since then, there have been 1.2 million mentions of hashtag coronavirus on social media. And you can see, mapping it out day by day, that's been growing, and it actually peaked yesterday. We'll see what happens today. But when you expand that search to be hashtag coronavirus or China, it jumps right up to 1.4 million mentions. So given that there is quite a high volume of conversation within such a short period of time, what are the implications for that kind of chatter and discussion on the internet?
Well, I think it's important to realize that just because something is being talked about doesn't mean the risk is increased. We're hearing from public health agencies that here in the United States, the risk is low. And we need to look for trusted sources of information. So we've talked about CDC and health departments, but also peer-reviewed scientific journals such as JAMA, the information posted on the AMA EdHub, and the AMA often amplifies the information from CDC to help make sure physicians and the public are aware of it.
Absolutely, and we will link to some of those resources that you mentioned in the post itself here. So look below in the comments if you are looking for some of that, including a module from EdHub that is specific to outbreaks. So that's great that you mentioned that the CDC is sort of the North Star of information, and that's a great place for people to bookmark and continue to go back to. Is that correct?
Yes, absolutely.
Awesome. So Andrea, you talked about these trusted sources like the CDC, but obviously people get their news from a variety of sources. So with that being said, when casually reading the news, what are kind of the earmarks of quality science reporting that people should look out for?
Well, I think it's important to note that the CDC obviously has calls with the media because that's a mechanism for them to get information out to the public. But when you're seeing people posting opinions or things that are not based in science, I mean, what you really want to look for is where they're getting their information from. Is that information coming from a trusted source? Is it coming from the CDC? Is it coming from, like we mentioned, peer-reviewed journals? What is the original source, or is it just someone's opinion?
Yeah, so I think it's also important to touch on the fact that just because there is a high volume of mentions, that doesn't necessarily mean that physicians shouldn't be out there spreading that information, sharing some of those really important trusted sources and making the internet a smarter place. Because as physicians on the internet, if you are savvy, we know from experience in working with many of our members that they are looked to within their networks as sort of that source of truth. So if physicians aren't out there spreading this information, then perhaps someone else will come in and fill that with misinformation. So I think it's really important to drive home the fact that if you are inclined to be out there on the internet, there's a lot of good information that you can be sharing to combat some of that misinformation, many of the sources we've covered here today.
Yeah, absolutely. And I know you guys do a good job of making sure the information you post is based in science, it's evidence-based, and is coming from trusted sources. So amplifying those messages that AMA puts out is a good starting point.
That's great. And to that end, I think everyone should follow the AMA on social media. Yes?
So with that being said, Andrea, thank you so much for joining us here today to talk about this really timely issue that's clearly stirring up quite a bit of conversation. As Caitlin just mentioned, for the latest developments and updates on this novel coronavirus and other things that impact the public health sphere, please follow the AMA on all of our social channels. That includes Twitter, Instagram, LinkedIn, and even right here on Facebook. So thank you for joining us. And again, thank you, Andrea, for being here with us today.
Thank you for having me.